Penny Jahama, yes, several Dadum Saint Count and showed it. Nanadumenti. Amen.
Amen. That's it. To touch on trying to share my screen now.
No problem. Yeah,
okay, good. That's it. Topic I don't perceive and common stroke, carotid artery disease. Tiabehe relationship or more management in terms of treatment options, and I said signs and symptoms as I say you pay attention to. Overall, no risk factor being a my stroke, and I said carotid artery disease, you go over it. And my such pictures be a bema me explain ya bema ya tiasie. And to say representation also. And I said, "Baby, show Adrian, Patrotron, and down to you, and I did home come into wait, no mechanic, where your objective side, and then you be seen. And he said, "Ya case, being a stroke." So, because of what is stroke, what does it mean? Basically, BB it happened all of a sudden. Blood supply not a deco brain, no matter oxygen, I say food, and I say nutrients of brain, BB disrupted that blood flow to the area of the brain. And so being a stroke up and say not start muscle, no, and I say tissues of the brain that I damage. And to not that signs and symptoms, it really depends on baby a blockage in the wall. I think there were two different types of stroke. There were ischemic stroke, and only when a blood vessel, and I said blood supply to that area and I block it, and I said BB a friend of plaque. Plaque and I said high cholesterol, and that's a fatty substance, and I said calcium, then build it up. It was blood vessel, and I mean blood into me and quote straight to brain, and into that blockage now, and then that am I stroke now, and I said will be in your blood clots. Baby a blood vessel in the wall. Into blood again, blood and into me brain and maninya and yamana to function on a daily basis. The other one hemorrhagic stroke, and I say because it will be bleeding on the brain one. It just means that vessel not a dead blood in the core your brain and BB one or BB causing I burst into a blood in the edge just perfusing in your brain, and a brain into your BB a very closed compartment. Into BB kitwabi it happened to brain now. Ubenya signs and symptoms, and I say effect na ubenya stroke na. Unfortunately, a couple of years ago, not stroke yet, the 5th leading cause of death in Americans to say is the 4th leading cause of death. Let me say, yet to help us to prevent stroke, And majority of Americans, the ischemic stroke, the plaque, and I said blood clots, that's the leading, the majority of stroke now I say. One thing I'm saying, dream sister says stroke, it's 80% of stroke is preventable. That means I given a year, but yeah, from home, Sani and Tinya and the day. But it didn't necessarily get from home, so I know we don't get into this problem at your stroke, some of the risk factors of stroke. It didn't never been a tinny putting at risk for stroke. And then half of somewhere never way, it be a high in tinny change, and it's your age. But stroke your diabetes at any age and crow's opinion. But so we drew after age 55, or risk for stroke a double. Into drew age 55, and then you bet me a yafa yentimin get to stroke. And also so sex plays a role in stroke as a risk factor. Emma is the greatest risk for stroke. And it's because your hormones and in it, a lot of things play into why Emma in your stroke more than Emma. In a race, unfortunately, Black people say have a greater risk of stroke than Blacks and Hispanic than a white race, you know. Another thing I see was high blood pressure. Unfortunately, high blood pressure, I said, high blood pressure or stroke, because that's one of the things that to me, I prevent it from getting stroke. See, before your DDM1, and I said lifestyle changes, and I see a before your medications. Now, I know said the Tory Bay and Percy before medications. You just said herbals and but blood pressure, you to me control or risk for stroke a decrease tremendously. After so family history of stroke, and that's a family history of transient ischemic attack. And your stroke now you're temporary, you know. When your symptoms now over 24 hours in a SAS, which symptoms no nyana, I are resolved. Not just said still to me function on a normal basis. It means that when you're stroke and lasted longer, which is good. And also when your MI or myocardial infarction, that's heart attack. And it's important to see about your family history. So that's why you need say your mom's side or say your papa's side will be a family history of stroke and I said heart attack. You know, and you could see a bit dig it deeper and who your family history. And tonight when we say, okay, I'm at risk for stroke, and then I'll be to me with me decrease the risk of stroke. And I said what atrial fibrillation, and only I said well heart rhythm, no, and irregular. It doesn't be as normal as it should, and also put you at risk for stroke. Or you'll be out smoking, and I saw high cholesterol, diabetes, obesity. You'll be out swim, and I said we'll take in a lot of alcohol, and I said kidneys and then injury be at your factors, and that's a risk factors that you put in at risk for stroke. Some of the pictures, some of the pictures in it show Obi explain ya to me etia say ye carotid artery disease a artery example of how a blood in it is supply artery supply blood to the rest of your brain. And two we had the hello. So her far right hand side in that. When said your friend saying the disease artery no. And I said, baby, your friend said, oh, I say normal for blood and it to me flow through. No, we had the top one now. I yellow, and only a friend a plaque no. Until we had blood flow now, as I said, a quote brain. As I said, I have very narrow into blood and into me quote brain as much as it needs to help perfuse the brain, and I said to help the brain ability function on a normal basis. And then they're putting you at risk for stroke. And I said, so when your blood clots, no, it will happen. Until we press our picture now, I said, be yellow. And no, de papa. Into plaque, and so like me kind of cell cholesterol, no, high cholesterol, and that's a fatty substance. I don't know, say, and that calcium, then you now build it up. It causes that blockage in your artery. It's our artery now where your neck and then your friend a carotid artery disease. See who saw blockage and not depending on how narrow it is, near friend will say, maybe 50% of the disease, carotid artery stenosis. And it's a idea to say you be fahon and sign us sending out block it completely. And that's just said right now, no blood supply to your brain. And then your friend a stroke and that's a brain attack into pictures immediate share what I say and just to show how your arteries, and that's a blood supply to you from your neck and your brain and how it all works together to help perfuse the brain. Into another thing is a carotid artery disease, and it is approximately 20 to 30%. It causes stroke. So unfortunately, the hospital and said by the time I will be by who's or sad disease and not just when you stroke and that's when you that temporary stroke until yes I not one of the doctors and because corneal ultrasound neck and say what carotid artery disease that majority of people are more stroke and yes will have about symptomatic about 70% of the artery are narrow stenosed and necessarily you be for home. And that's the big major relationship between stroke and a carotid artery disease. So depending on how severe not or neck artery I stenosis and that's very narrow it just puts you at a greater risk of getting stroke. And also like the plaque, again, will cause you to have that temporary or transient ischemic attack or stroke, where basically you don't have enough blood flow to your brain, and you're friend hypoperfusion, and your brain is not getting what it needs to function on a normal basis. In terms of plaque, and a picture I'm the show has saying, it's very nasty, and yet baby papa, because we hear and never will a blood vessel anymore. A better than that blood in the team brain. Nature say the baby found to me in a free home and sana what your good blood flow to your brain. And depending on the type of plaque I want, you're different. Your ultrasound now, your ultrasound technicians, no matter what type of plaque it is. Depending on there's 3 different types. Depending on different types of plaque, who's at risk of ischemic stroke, and I said your risk of hemorrhagic stroke now, and I said, oh, depending on stop plaque now on the one. So we need symptom crack. Oh, I say you be found, and I say do cause surgery. A free one. And signs and symptoms, I think said that's one of the most important things. As I said, you pay attention to for stroke. I think saying because the acronym FASTA, Ubinya stroke, I will share the facial expressions. Facial muscles need to be so weak set. Your favorite be facial droop. Not just say, oh, one side of your face, because muscle near weak, I drop up or smiley and then necessarily changing. Another one, they say, when your arm weakness. Well, to her now, he said, lift your arm up, or lift your ass down. And that's a sign that so pay attention to for stroke, arm weakness. And I said, if I be slurred speech, or kasa saying ya kasa say and that all of a sudden will kasa change, and I say yes, and I say what kasa crowd will be tiasie. And only be being so as I prompt you say, oh, the dear neck console. And I said, I know kasa say, and I saw no beautiful so then kasa all of a sudden. The kasa change, it's very important. Say, we fret, so we name the chain or friend name young man. I saw friend 911 immediately. And another thing is time. I know so sometimes you have symptoms and I say be high, I say, oh, me okay. But stroke the idea time, no, it's very important because of time you've been who so you're normal for a war. You're normal, you can say time of your normal function or neurologic function, meaning it's a time I will be who say you're okay. No need determine your friends a treatment plan I did them out. It's the time window is like 3 to 4 hours. And it's very important. So when you say slurred speech and I say facial droop, and I so catch you and I saw friend 911 immediately. Another thing that as I say pay attention to in terms of science, and they say being to me loss of vision. And it's just temporarily. It's just cause it like maybe a seconds or a minutes. And I said when you're like one side of your vision, when you're blindness, and I said it's blurry. Usually a minus or more symptoms in it, and yet different from the norm. The norm is over your facial droop in it. But in my symptoms need different. It be to me loss of vision for just one side. And I saw moon who be and I saw you foggy. Signs of stroke, and I say pay attention to and at this arthur and a slurred speech, and I say slow speech, and I make kind of it being so all of a sudden we all have a difficulty swallowing, and only a friend of dysphagia. Aphasia, something that so when you're like it has a full-blown stroke ultimate crown kasa affected how I'll be to me kasa we was on to me kasa being kasa crown so kasa will be tiasia crown. And their kind of weakness, and menoparesis. So one side of your body, it gets too weak than the other side. And I said, unfortunately, being on one side, into me moving a cry, and they say find a partial paralysis, that's just that there's nothing you can do into me moving one side of your body at all. Hypoperfusion, so the bright light amaurosis, and only and also so like can you call a vision just by being in a bright light. It be multimedia lightheadedness, and I said dizziness, and I said I saw more sorry, not all of a sudden or to me engineer. Meaning, signs and symptoms of stroke, I say you pay attention to. And I say, so when will be at 1 hour kasana, so be catch us, oh, and you are me feel like this and that now. I say, who said, okay, dear, okay, if you a stroke, and I said it's important to over friend 911 right away. I don't want us to ignore the signs and symptoms because a baby say you and tema I prevent you from having a long-term effect of stroke signs and symptoms, and I want to know what keep them now. And then in terms of diagnosis, then I'm person who said they kind of said, unfortunately, by the time I'm working, by the time you've been home and by your hall for ultrasound study, not a stroke already, and not so many that temporary stroke. And based on that, more primary care say, oh, because so vascular surgeon. No, or so carotid artery disease. Some of the diagnoses are for stroke, and they say CAT scan, and I say MRI. Which a picture on the far right, the one that yellow now, and only a CAT scan. And the arrow pointing it is showing how narrow. Because I said a vein or neck, how narrow it is into. So, opposite blood net it flow to brain into me because I block it. And then I pay attention to, so you pay attention to how narrow your vessels are. And another picture in the middle is the contrast. And it shows that the part of arteries now are very narrow until we need to do something about it. And then the last picture on the far left, and your ultrasound or more your technician or more measure the flow, how blood in it flow through vessels, how thick the blood is, to give us a percentage set into how bad is the artery I stenosis and nasa kitweb, and for instance, majority of carotid artery disease, and we use the ultrasound. Your ultrasound will neck blood vessels, to figure out how diseased your arteries are. And how do we determine what the best clinical management is? And as a DNA team, what is our goal? So you can also be in your carotid artery disease, and I said will be a risk of getting a stroke. How do we determine that? And when you're looking at age overall, no, your hair so heart near healthy, and I say you're healthy. Your hair baby a different thing, baby narrowing of, and I said baby our blood vessel no I kit one your hair and your hair lesion to make the best decision set. Is it baby a bit timid a medication a treatment, and I said baby as I said yeah surgery. And let's see, some of the medical treatment to help reduce your risk of stroke, and then so majority of people when you're stroking you put you on one aspirin. Why aspirin? Aspirin a drobia your friends is basically a stopping cells in the blood from shrinking cells in it will blood, and I said it causes blood needs to stick together to form a clots. So aspirin to me it help him many jaisa, so then it doesn't form a clots to block your arteries. Until a drobia so risk of stroke, and that's how we have majority of obia when over 55 years and above, primary care sometimes will put you on aspirin. It's just to help reduce your risk of getting stroke. Another medication I did, Emano, it's a medication friend is statins. It's a lipid management. It's for cholesterol, high blood cholesterol. You who say well lab work near who say cholesterol upper near the friend a torvastatin and that's a Lipitor amount just to stabilize that plaque and they're not a yellow being a block or arteries, it's to stabilize it so I need to get too bigger, and I said it's me sorry it's me and get too big and block arteries to your brain, sana blood flow no etimia flow properly. And also in terms of the lipid management, we will be able to smoke catch us at dry smoking because I know it constricts your vessels. And I said, oh, smoking quite dry completely. I know some conformist looking at doing some big dry. Again, the biggest thing I'll be to prevent yourself from getting stroke and blood pressure management. And I said blood pressure control. We will be high blood pressure. And I said, we are close to getting high blood pressure. And so we get lifestyle changes be a bit reduce or risk of getting even that high blood pressure, and I said putting you at risk for stroke. So bit me 15 to 30 minutes a day and I say a DDM when I say so one of the most important diets and so for low sodium and I say low salt diet. Now we'll do plenty of fruits and vegetables and I say here DDM. Another thing is diabetes. Diabetes disease be a enya cry and into a put to risk for stroke. And to do it my when it says will be blood glucose count it needs to be less than 7. That's your goal. Yes, so now to me decrease your blood glucose count. So more than now to me another thing is alcohol consumptions and we'll be able to drink it too much as a jai. And also let's see. In terms of surgical interventions, unfortunately, again, any medical treatment, is an option for. So we will be at doctor you're concerned about. So being a carotid artery disease, if you have meet signs and symptoms, and I say unya stroke, but until so we are now unya stroke, and I say unya symptoms of stroke, not your ultrasound and near who so or stenosis, and that's a narrow and 70 to 99%. Unfortunately, I see surgery. It's me plaque and in free hole, and I say blood clots and in see free hole. Now, when to me stroke, the whole point is to prevent you from getting stroke. But unfortunately, so you'll be when your stroke symptoms, we still ultrasound and now we at 50% of your 50% or greater of your arteries is stenosis, then we'll take you to surgery. The preferred surgery are carotid endarterectomy. And when I picture the middle and I said both pictures and basically I'm more expose your neck normal core artery mean no may you start plaque yellow stuff and in your nerve free we are normal patch suture it together just so you can have better blood flow to your brain. Another thing, so Obana said only issues with stroke and I said when your symptoms and I said when your stroke but stenosis near less than 50. What we do is we watch you closely. You do about usually depending on symptoms, you do about 6 months, you do about a year until you to me follow more very closely. And I say your patients know more carotid artery disease, because I say idea is to pay attention to not and you're too big. Say vessels near narrow. It doesn't mean that over years, and it doesn't mean that increasing over the years and increasing. So a year increase now 70 to 99% now. Then unfortunately, I say I take you to surgery. It's in free hole. Another type of surgery, carotid stenting, and only at least invasive. And the stent. As I said, the picture is shown. The stent open blood vessel, just to help put more blood flow to your brain. Majority of women intimate and tolerate carotid endarterectomy, you take all of that into account. Will be a intimate tolerating invasive surgery, stenting and that yetimi yama omo. Another type of surgery. say abaso, and it's fairly new. It's basically combining the two surgeries, still your best suppose you neck and then near the stent in Ashahol, just to help put better blood flow to your brain, and also your least invasive set. And no route in upper set or quiet. Again, we are patient, and I said we will be at what this disease are. You have the choice to decide what type of surgery or person we are. Or surgeons and they'll work it together. They'll give you their professional opinion in terms of which one will be best for you. But at the end of the day, you have the right to, do more digging or seek second opinion. One thing I'm person share for you, I said, don't ever be afraid. Said, well, Dr. Kabi be extra while be seeking second opinion. It is in your right. So Beher said, they're all kind of your correct. And I said, they're all kind of on your so no be for kaka home. And so waka yes. And all of this, the take home point I'm passing and I said, stroke here, it's very preventable. 80%, that's a huge number. It's and he said, oh, fear and I saw or stroke and as signs and symptoms. And again, the most important thing is to who be said the casa change and I said or cerebral not as in the facial droop, the serial change yeah. Well, because of my arms are weak than the other arm, and I said blindness and the signs and symptoms are causing yana. It's important to over to your catch on so almost for 911 immediately. And I said so stroke the next day uncle who the primary care just to seek clinical treatment because they be able to be a phone. And I said risk factors, lifestyle changes, and it's always number one approach. So lifestyle changes and not one put to a risk at getting stroke. And I said, and don't be scared to talk to your doctors or call or primary care visitor. Your next visit was almost on a detailed assessment. Sometimes a primary care and the team listen or the stethoscope and they listen to your arteries now. But to me, TA sound to be a friend of brewery, which is basically it's irregular, pulsating sound. And no to me alert you. I'm say, oh, okay, ABI carotid artery disease and vascular surgeon. And to or next visit to now mention sometimes it be more a thorough assessment. But as one I will pokey or primary care no more there's some more now who said, okay, at least this year require and BBI okay. And I also make sure saying fire medications as prescribed. And another thing is some person it says that medical people be sorry and I said more nurses and I said doctors be sorry don't be scared to talk to them and I say seek advice and counsel depending on medical issues are more we are here to help. But said now it gets you too later. It's by the time I catch you be now you're too later. To me my advice I won't hear to see the right people in team patrol. Some more medical people who are how we trust in that, just start talking to them right away. And I also, again, healthy eating and lifestyle changes, less salt. I know say again, salt in the money there, but I say less salt and I say walk here and I said, some type of physical exercise 3 times a day be to me boy and tea. And when I'm person share with the whole church, that's it. Thank you guys for your time.
That was it. Mama Belinda, Yamisha, so I'm a corner rather falso. I did the same way I bear and I said, Sir, this shadi abe, Yamisha be pray. I did it for you, but Nanuesi. I been so be was in Busa and I said, we was some account with a family one. A pamacho, obetim de Habana Fino additional every mode. Madam Massey. You blabus your full good surgeon get on the Babylon. My mammy saw a question back away. Any kind. Now, would you walk us some more can be far? One patch. But okay, baby, say so. Would you feel say 55 years now? It says sex with as I said. We in other one the open so chance say it be a bit more will stop. Now so yeah, at the same be seen you who say Sabe quality be a mumma here. And it's how do you explain it? Pacho.
Oh, Pacho, what's it say? The kind says 55 years and above now. And as I said, it be a wusher we was sex, Mona daddy. Meaning, so person do what, yes, top of cry, and 15 as I said. No, me cat sex and now me Pacho said male and female, sorry. And he said, if you don't person chest said, we are a greater risk of getting stroke than Bema. And now we can't say risk factors for sex now, that's what they mean.
Okay,
yes, that's like your sexual orientation. So you're a greater risk for getting stroke than Obama.
And the second question here, the surgical interventions, no. Which is some picture be an assembly for Nibicha, who pay. Baby, no, the agent said, and I said, the who said, you see, I'm more said, you man, I did now. It be a choose number, no. Sometimes, it be a refit, it be a mudia bit to monada, now problem about. But I follow a disturbed at home, a no crack, and that's a no crack.
Yeah, I know, said sometimes it's me, but. We'll say a medical community not taking a very close look at that until your steps or surgery. Why you're not just there with the doctor, nurses, or anesthesia until there's a whole group of people are more counted. And you see me and as I said, you're counting many who said you really send your sooner so you see 10 devices are. We surgery now, so making sure set 10 devices now you see a one chain I between throw away. Say until throw in terms of that in the county. So I'm counting I said who be scan on your between like imaging and I said like x-ray and I said CAT scan immediately to her baby Sanya man a wall say maybe you refi na mujai no body ni ma sa scan no betimi ama ye hu say okay ebi a wa ha sente so mu call back ekoyi ni nyina but e bibia etimi si but say besi there I think that at this point surgeons do not pay very close look at it and we don't see that as much.
Yo medawase ebe me besi na abusuafo aka so obi wa sembesi yeah, I did it for me somewhere. So, do I say, Missy, be waiting that ban off, the third question, I want to make that actually, Madam Assy.
Yo, me pacho, can Miss Mimisa back be in
Yeah, bra, pacho, bra.
Yo, that's far. You say, now, or can say, if you want. Nipa si di esi etie no kra no etimi eba se ye was hard risk no kra in advance titru ne atuntun form me trebi so a ye mbisa ye busu ma na se ye hwehwe se ebi ewo ho ana se bi ni ho a na che se ya fe ho adi ana se ebi ni ho kra no o na obetima ye first person na obetima ye pie na se etisa and na die na so wo bio na wo ni bio na o ka se ye hwe di die ya na se ye hwe ho ye bi no enuani ana se ye den die ni ye nie Gana ye dokno ne ye sito ne no ni die ba sa ma die na ye nyo die na ye nie a ebeti aboa ama ye nkunya kra se ebi wo ebuso ma na se wo na be first person na efa also emma.
Amen.
Yeah, that unfortunately, the all kind of credit. It be mutiminya all of a sudden. It be many risk factors, and I said many family history. Crowd, all kind of bit me. I be the first person that bit me and yasa stroke now. It's crazy because this past week in the patient to be na only family history bia, or you're very young in the 30s, no, you're the first time to get stroke. To me, or you perceive within it didn't tina or timinya stroke, but it can happen spontaneously at any age. And today, pete the obetimia ya fa hon and a kind of DDM, DDM, no. I know see you pay a document, you pay full, but at a certain point, you know, so putting busa hosenti, a janina meeting. I mean, everything in moderation. A janina meeting at this time, never boame. Oh, and Tina, because even if say you DDM, say you use salt a lot, and I say sodium a lot, and I say a decrease, you know. The journey, I said, the kid to a binary. Until they bet me a boy and pan and a lifestyle changing and say a DDM, and I said, yeah, you're making sure say you're physically fit, and you say a better exercise. Kakra said, over me, I walk it 3 to 4 days a week now. And so, wow, Hona Timmy, I walk it Kakrana a bebwao. Because what happened is that a DDM, especially for us Africans, you know. I think say cholesterol no yet a big deal because you eat a lot of meat. Oh, in Tininya, it's cholesterol, a lot of fatty substance. And in Tininya, what you're doing is you're putting your risk at blocking that artery, no. Into the boy, we need family history, the most important thing in it. Your DDM activities now and another thing is your annual checkup, no. I say you pay attention to your blood pressure, and just because say your blood pressure, any blood pressure issue, maybe this year, and I said the past couple of years, and it doesn't mean saying to me, so if I go to blood pressure machine or CVS, and I said Walmart to crowd to me to be no to me monitor our pressure. The goal is to be my blood pressure now you're low, because that's one of the biggest risks of stroke. And I said stress, and when your blood pressure can now you're stressing out. When you're stressed out, your body is reacting to that until pressure record high, even though you don't have high blood pressure. Until your BBS centers you pay attention to. That's it.
Yo, open the aba, Pacha Fabra.
Pacho, now Kabi say, do stage binase, Unya. Bibisana not to a boy would nurse or service in the PP more. Now you put will be a community request patients maybe on that street. And make us say, I advance I will say, then my info questioning me. Advance I will say, the Russia said that pass spring be anonymous. Daily and now weekly basis. Yes, yeah.
Aspirin, no. It depends on age, you know. Aspirin, like I said, 55 and above, you know. Yes, over to for aspirin daily.
Without doctor, without a doctor.
No, but the most the most important. I saw no primary care in casa. Someone who age will put you a stroke and you put you at risk for. To say 55 or no and above, no, now risk for stroke and a double. And I say, okay, now primary care and say if I want to aspirin be as well. I said this is the time I'll be to me a busa. I say, okay, what's your BBF stroke? And I said carotid artery disease, you know, now okay, so no a casa her said, is it a good thing? So be to me, I take aspirin no. And so, who drobi I will take you in general.
Especially, say, if you can, the moon sense, and you will be an preacher, maybe all the advice club will be. How the crowd over, so check your problem, no? Because you are more and 7 on 6 no. Very different. Now, Obi was age, you know, now catch and say, oh, so there will be some to be a sign of this go over the country, not to have aspirin. Now, regulating, no, without doctor's prescription. Is it bad?
It's unofficially, it's not bad, but set me, you know, medical provider and send me my advice, you know, say I know say yeah, and you may be in doctors and I say bisa, but and yeah, a aspirin, so yeah, a drobia say risk of bleeding at something so yeah important say you be who and sana wafa. Internet a drobia or befabe can say oh I say who doctor and son yamo I take his surgery no, but say we be a yeah checking your labs now when you risk or bleeding risk and a lower betting yafa into the answer now waiting the amount of evidence because me person make us say yes now kofana saying who say bleeding risk now because me bleeding with aspirin. It's good to me no be to me akuhu doctor be and then akasa and sana what take his medication no.
Bleeding with aspirin, and I found a name bleeding at the how bleeding to be a whole beginning to be a Miko me bleeding fine. No, Bema will be bleeding fine. Risk of bleeding, I mean to me.
Bleeding, maybe a different size, sir, or you bruise very easily, or be how or take certain medication and channel who said the skin or bruise, and I said blood be up at top skin no who superficially. And I said, BB, as I would do when I bought a diner and while bruise, you know. So we will be risk for stroke. I mean, or bleeding risk and I'll be put me on the side. And I said, say, be cross, say, oh, use the bathroom, have a bowel movement. When say that color that change it. Into no you be so pay attention to. Into the color need change because oh, okay, I need to say dark and I said coffee ground type of color. No, let's just say. Yes, and I asked for now we're taking this, so thank you. It's there were two different dosages. You were 81 milligram aspirin, you were 325, which is full dose aspirin. Aspirin now you did my stroke patient and 81 milligram DNO.
Like I said, a higher dose or
no, a low dose aspirin. Yes, 81 a day. Yes.
Okay. That's about
you know, so penny morgan, watch on
baby, will do ye. A Jamisro, Mammy be some back up and up.
Okay, Cosso,
and they said, said you see mu ye one a dosage no be bribia okay. Mati say omuka junior aspirin and no okay and I say a leaf no de emubiano and I say
no aspirin a leaf when it's a different medication group and I say who bought on it aspirin and yes omuka junior aspirin is baby dose aspirin and no that dose in 81 milligrams you know it's so we answer what toss our pill no.
And you say be a tea pie one. I say, yes, you walk to a spring where you be known a leaf crana, you no be no walking, nemo, a spring pie, and then also near friend junior aspirin.
But a leave no, yeah, your friend medication group in the NSAIDs, you know, so I no for pain relief and then near myself, but baby aspirin, no, it's in the group of your friend antiplatelets. Oh, it's confusing because Nina will almost different group a year Juma. Oh, say like oh a headache and I said BB like oh pain and yeah leave now and yeah aspirin I'll be fat because that's not aspirin's job. So a bit and no be more a bit bow for pain. So let's say oh body cramps and I said muscle aches now maybe I'll be fat a leave. And I said Tylenol, and I said ibuprofen.
How about baby aspirin?
Baby aspirin, because I know your friend say antiplatelets, and they're not making one presentation.
Command say, and then say you're good.
Yes, and then your friend, yes. So baby aspirin with the Google group name, baby aspirin, 81 milligram dose.
And yet, junior, name a baby.
No, I think it's a Ghana for friendly junior. How Moka it has a friendly baby aspirin. I think so Ghana for Becca junior aspirin. And no, but the most important thing yes, but the most important thing is about that is set. I said we pay attention to a dose, milligram now. I said, oh hold on, I mean I took everyone. Hold on.
Yes, they the same.
It is the same.
Yeah.
But Obika junior aspirin, baby, American baby aspirin, I say you're confusing, but it's the same until so we take care drug. Person who's the most important thing I'll be pay attention to no a number no. Media group 81 mil a bottle on home. It will tell you baby aspirin 81 milligram.
81 milligram now for Bakwa, I'm
saying dairy.
Yes, one a day.
Yeah.
One a day, okay. That was a part.
Maybe I try meeting me at work.
I try, that's it.
I'm said that your friend is saying baby aspirin, aspirin 81 milligram, the same thing. Now, dear Bakwa now, and stable in the can say, will say, your doctors who know dry taking a boapa because and you be on my idea, be to say Spanish. Spanish, so with this Spanish, it me Emma, a friend is saying, bleeding of vitamin K. And since I would take it with this Spanish, say, go on my do be a opus would be and woody. At the same time, we'll take aspirin. At the same time, be a will take another anticoagulant. Into us, I will take more a friend is saying anticoagulant. Though Spanish ye Adriana ye but I also vitamin K. Into the say a bit take care drobian and my doctors in whom. And no, take even a herbal medications. Need one blood pressure. It's me my blood pressure also. It be my blood pressure from. And as I say, a drobia ye take bia. Even say a friend is saying herbal a friend is a medicine crana. As I say, my doctors no. Say if it's preoccupania or fat a friend is saying a drobi na your normal. Na your doctor nima. Ness or some prescribing no food for be mine. A bit me high in future. Into the advisor will say a drobia na yenum biano. And I say drobia ye pese ye yenum biani your doctor who no who say a wine at this at that moment na I say wine. Usually no bia or taking blood pressure medication biani usually doctors no almost 2 aspirin so because a go in handy like the way work it together. And a advisor will say biara na a drobia yenum biani be my doctors. And who a dry year, no send a bear that chibiano, and cohine with the massipi.
Amen. Amen. Omicho, Ubiwa, and Fufu between the Abba. Sama. Pacho, Mama K, why me too? Professor Kasa Kwanda Homa.
Pacho, me bisa sam kakra.
Yo, Pacho bra.
My memoir shall me bisa say every Sunday the same time obeba. And now obeba so be boy me be TV biana.
Yes, but I am in your invitation now. It's a time to me, but I think say a program no yes or selected Queen's leadership and a selected your friend saying speaker will be to me about each week.
Bele da simpachoye mwa wa hakaka. Every Sunday be a programming different topics. Every Sunday be 5 o'clock to 6. Yes, our program, but a different topic. Bele da besa be but all next Sunday. That's it.
Amen. Yo, opening iPhone be pejalinsa. When say why ready are the more quite fin makasa. They go to iPhone or pejalinsa. The audience are to the. Yo, so be any question there, and Mamma for Wimbra. Mammy Belinda, what can be fire say, Ebia, see him, Webia. A bit may be say, I suffer man, or my nurses not there, I don't know, said the Baya. And you may be salon, but my boy, and I hear whom queer for swear. Ye bit me a year near Mafa, and a year advice or the man, Jesus, and whom he a pie. It's in American say, Mumma in a fun to Yadinimo. Now, and you may be a young child, and now what can you who you know? You need a nurse for another doctors or more ya suffer mono. You know, Mundin come out, laughing no woman may more in church. You must be a bit me at Tiasi, and the advisor, my maker and Passina, I know it required you more. I don't want to say.
Yes.
Yo, Sabine to be in your same be idea, and a mamma Belinda, a mamma or kind of fino, and I thought to be Audiano, would the about nothing, no, ya bompany sure or some so.
I don't person with Dama say, some to mamma, a quenya way a church in the Obia Casa, and to Miss Medassa for invitation. No, so Munya be and Patrol to me, reach out to me.